All right, well, thank you so much to the organizers for the opportunity to be here. It's a pleasure to talk to you all today. I will jump right in because I know we have so many other exciting presentations to get to as well. So I'm a mental health epidemiologist, and I think the invitation to come here today speaks to the fact that mental health problems as a result of the COVID pandemic have been at the forefront of many people's minds, really since the beginning of the pandemic. So the pandemic can be considered a traumatic event for, I mean, even if you haven't sort of thought about it in those terms before, it meets all of the criteria for a traumatic event because it has the potential to cause both physical, emotional, and psychological harm, which is kind of the public health definition of a traumatic event. But even kind of in addition to the pandemic itself, kind of the spread of the virus itself, the policies, the measures that have been taken by necessity to prevent the spread of the COVID virus have meant that we're all dealing with new life stressors and tremendous disruptions to our daily lives, really for most people in the United States and of course around the world. This is not an isolated thing the way kind of a hurricane or a tornado is. This is affecting everyone, everywhere. But it is falling sort of potentially most hard on people with various pre-existing vulnerabilities. So the unemployment levels that have reached record highs are just one example of the disruptions that have been caused to everybody's kind of daily lives. So I'm sure it's not a surprise to anyone to learn that mental health, our mental health, our anxiety, our depression levels, and so on, are very sensitive to traumatic events, as well as to the social and economic consequences of those traumatic events. But there are groups of people who tend to be more sensitive to the disruptions caused by traumatic events, including COVID-19. So folks who are already struggling with socioeconomic and social adversity are especially vulnerable to mental health consequences. So I'm going to launch right in just to give you a sense of kind of what the research is showing already. And I want to make the caveat that there is lots that we don't know yet, but oops, sorry. Am I actually sharing my screen? I wasn't. I'm so sorry. I just realized it wasn't. It was showing up on my screen and not on yours. Okay, so I'll launch right in. So we don't know a lot about mental health, but there have been a few studies that have come out. So this is based on survey data, and what it's showing is the prevalence of mental and behavioral health problems in the US as of June 2020. So the pandemic was well underway at that point. And what this is showing is that levels in the general US population, about a quarter of the US population had significant symptoms of anxiety disorder. A similar proportion of people were struggling with depressive disorder. Almost 15% of people had either started or increased serious use of substances, including drugs and alcohol. And more than 10% of the population had reported that they were seriously considering suicide in the past 30 days. And what's kind of particularly concerning about this is that there were some groups that were really vulnerable. So Hispanic and non-Hispanic Black individuals had even higher rates of many of these problems. Essential workers had higher rates of these problems. People who were caregiving, either for COVID patients or other people, had higher rates, as well as young people and people who are already being treated for mental health problems. It's also helpful to look at like what was happening before the US. So before the pandemic. So what this is showing, the dark bars are before the pandemic, the lighter gray bars are during the pandemic. And so what this is showing is that for depression symptoms, rates like went up dramatically during during the pandemic. Give you a sense of kind of the scale of how bad things have gotten. So depression symptoms went way up during the pandemic versus before. And again, we're seeing this sort of concentrated in vulnerable groups, people with lower household incomes, with low amounts of savings, and with people who were directly affected by the pandemic. So they had lost a job, they had lost someone that they cared about to COVID, are experiencing financial problems. And so none of these studies have actually looked at rural areas in particular, which is a big sort of gaping hole in the research that needs to be corrected. But when we look at the racial and ethnic breakdown, what we see again is that both non-Hispanic Black individuals in the United States, but especially Hispanics, are reporting really high levels of mental health problems. We don't know how this, depends on their occupation, on their immigration status, on their, residence in a rural or an urban area. So all of that needs to be investigated. But it does suggest that in areas like the San Joaquin Valley, which of course have a huge proportion of people who are Hispanic and, in these more vulnerable groups, that we should be prepared to see pretty adverse effects of the pandemic. So in the San Joaquin Valley, so I'm a part of a study called the CLIMA study, which is looking at the impact of the pandemic on Latino immigrants in rural areas of the San Joaquin Valley. This is, we're doing in-depth interviews with immigrants, Latino immigrants in Merced, Tulare, and Imperial counties to understand how the pandemic is affecting them. So we know that they are already a very vulnerable population, as Dr. Burke and others kind of laid out in their presentations. And what we're seeing in these interviews is that the pandemic, of course, has dramatically increased their vulnerability. They're dealing with income loss, with job loss. Many of them are having to choose between, their physical safety and bringing a paycheck home to support their families. We're seeing that their employers are not providing personal protective equipment, so they've got to pay for that out of pocket, et cetera. But there's also new expenses. So they're needing to get broadband internet so that their kids can attend school. Food expenses have gone up, childcare expenses have gone up. So when we asked about their mental health symptoms, we asked about their depression symptoms and their anxiety symptoms. And many of them are reporting significant levels of depression and anxiety. So almost a third of them are saying that they have very little interest or pleasure in doing things as one of the core symptoms of depression. That when we ask them, how often have you been feeling depressed, down, and hopeless, more than half say that they feel that way a lot of the time, either like nearly every day, more than half the days, or several days out of the past couple of weeks. Same when we ask them about their anxiety symptoms, nearly 3/4 of them are saying that they are feeling anxious, nervous, on edge, like most or all, a lot of the time. And almost half of them say that they are just not able to stop or control worrying about the future, about their families, et cetera. So these were qualitative interviews, so we have all this sort of rich interview data. I'm not going to go into a lot of detail about it, but just anecdotally, what we're seeing is that they have so much stress related to their family's safety, to their ability to put food on the table and bring home a paycheck, that it is really affecting their mental health. Several of them mentioned that they've had to go to the emergency room because they've been so stressed. They've had to do things like start taking sleeping pills. That both the participants and their families are experiencing depression and really severe anxiety symptoms. So this is playing out in the San Joaquin Valley in a really serious adverse way. So in terms of kind of things to do about this, I don't have a lot of concrete suggestions. More research, more policy work is needed on this. There are individual measures, things that people can do in their own lives, trying to get telepsychiatry, mental health care. There are helplines. Social support from friends and family is really important. But I also want to make it really clear that these are individual solutions that are necessary because the policy environment has failed us, and particularly failed vulnerable populations need our policy solutions, income replacement, including for eligibility for non-citizens, employment security measures, beefing up the OSHA regulations or implementation of OSHA measures, and ensuring that people's basic needs are met. And that should be kind of an expansive definition, including broadband and access to personal protective equipment. So that will depend on the work of coalitions like this and other folks.